Hey guys, welcome back to Bread and Butter Primary Care. I'm Dr. Stokes, and this is a video on statins. What are they? So what are statins? And this is a video mostly for patients who are likely on a statin and may be wondering what it is and why they're taking it. It's a very, very common medication. If you've been to your doctor recently and they've recommended you take a statin, that's what this video is for. So statins, which there's several different names of those. So most commonly there's simvastatin, atorvastatin, and rosuvastatin. Those are probably the three most common. That's Crestor and Lipitor and the simvastatin. And so if you're on one of those medications, chances are you're on that in order to lower your risk of having heart disease in the future. And when I say heart disease, I mean like a heart attack, a stroke, or some sort of vascular problem. Statins are medications that inhibit the production of cholesterol at the liver. We get cholesterol from two places. We make it, our body makes its own cholesterol, and we also eat it. Some people make more than they need. It's just a genetic condition where they're making way too much cholesterol. And that's what statins do. So they are inhibitors of an enzyme at the liver called HMG-CoAs inhibitors. And they prevent the production of cholesterol, and so they lower it in that fashion. Eating cholesterol is still going to raise it. They mostly function to help reduce the cholesterol that your body is making. They're very, very commonly used because the studies have shown that they do have good effect in lowering people's risks of heart attacks and strokes. There's lots of things that give people risk for that. So mostly statins are used to help prevent heart attacks and strokes because of high cholesterol levels. But what your doctor usually does when deciding whether or not you should be on a statin is they consider the entirety of your risk. So that includes your blood pressure, your cholesterol levels, if you have diabetes, if you have a smoking history. All of that gets put together, and they use all that information to determine how high a risk is this person. And if that person is higher risk, then oftentimes statins are recommended to bring that risk down. If they're lower risk, then not so much. And so if you're a person who you feel like you don't have really high cholesterol, but your doctor has still recommended a statin, it may be that there's other risk factors that he or she is looking at. And so that's what a statin is. It's a medication that stops your body from making its own cholesterol, that can lower those numbers, reduce your risk of having problems in the future. I hope that's helpful for anyone who was kind of wondering about that. Any other particular questions that you may have, leave them down in the comments below. I'd love to see those and answer those. Any questions you have about your own therapy, whether you should take it, whether or not someone you know should take it, or anything like that, I would advise that you take that up with your own primary care physician so that they can advise you appropriately. I hope you guys have a good day, and stay tuned for more from Bread and Butter Primary Care.